Welcome to Tocilizumab Chronicles Beyond the Cytokine Storm, the podcast where we break down the science behind this powerful medication and its impact on modern medicine. I'm your host, Dr. Shikha Agrawal, and joining me today is Prachi Virat, our microbiology researcher with a passion for microbiome and bioinformatics. Prachi, it's great to have you with us. Let's decode what's really happening here in today's episode Tocilizumab Safety Profile understanding adverse effects and mitigation strategies.
Appreciate you bringing me back for another round of good science talk, Dr. Shikha.
Let's discuss the safety profile of tocilizumab. What are some common adverse effects associated with tocilizumab treatment?
Great topic. It's so important to understand both the benefits and risk. So, tocilizumab, like other immunomodulatory therapies, come with a predictable set of potential adverse effects. The most commonly reported one include elevated liver enzymes, neutropenia, thrombocytopenia, hyperlipidemia, and increased risk of infection. In context of COVID-19, we are particularly watch out for secondary bacterial or fungal infections. Mild gastrointestinal symptoms like headache and infusion related reaction can also occur, though serious infusion reactions are relatively rare.
You have unpacked that so well. So, how can clinicians monitor patients for potential adverse effects?
Excellent question. It's really all about proactive monitoring. Clinicians should regularly check liver function test, complete blood count, lipid panels, and inflammatory markers like CRP. In COVID 19 patients, it's also critical to keep an eye on signs of secondary infection such as newer fevers, hypotension, and unexpected clinical deterioration. When given in chronic conditions like rheumatoid arthritis, these monitoring parameters are typically assessed every 4 to 8 weeks. In acute COVID 19 settings, labs are often done daily or every other day during hospitalization.
That's such a helpful perspective, Prachi. So, what strategies can be employed to mitigate the risk of adverse effects?
Great follow up. Risk mitigation really starts with careful patient selection, avoiding tocilizumab in patients with active or untreated serious infection, severe liver diseases, or gastrointestinal perforation risk is crucial. When using it, pre screening for latent tuberculosis is recommended in chronic use but isn't always practical in COVID 19 emergencies. During treatment, timely lab monitoring, adjusting or withholding other immunosuppressants like high dose steroids when possible, and close surveillance for early signs of infection are key strategies. Also, ensuring patients are vaccinated against common pathogens before starting long term tocilizumab is a smart preventive step.
Well, are there any specific patient populations that may be at increased risk for adverse effects?
Yes, absolutely. Older adults, immunocompromised patients, and those with pre existing liver or hepatological abnormalities, and patients with history of diverticulitis or gastrointestinal disease are at high risk of complications like infection, hepatotoxicity, or bowel perforation. In COVID 19 settings, those already receiving multiple immunosuppressants or who have poorly controlled diabetes or renal failure need extra caution.
Having learned about the adverse effects of tocilizumab and its risk, how can clinicians balance the benefits of tocilizumab treatment with the potential risks?
Excellent wrap up question. It really comes down to risk benefit analysis and context. In severe COVID 19, the short term benefits of tocilizumab is reducing inflammation, preventing invasive ventilation, and improving survival often outweighs the potential risk, especially when patients are carefully selected and monitored. In chronic diseases, clinicians need to weigh the long term infection risk and metabolic effects against the benefits of disease control, improved quality of life, shared decision making with patient, and clear discussion about potential side effects and setting up a strong monitoring plan are all essential for safe and effective use.
Wonderful, Prachi. Thank you for laying that out so clearly. Before we wrap up, what's the one key message you'd leave listeners with about tocilizumab safety profile?
Thank you for meaningful conversation, Dr. Shikha. I would say the key takeaway is tocilizumab is valuable therapeutic tool But like any immunomodulator, it required careful patient selection, vigilant monitoring, and personalized approach to balance benefits and risk effectively.
And with that, we wrap up another great conversation. Follow, share, and stay tuned for more insightful episodes coming your way. Until next time, stay curious.